This is a simple, straightforward bicanthal plane glaucoma image, just to assess the angles in the right and left eye. So the operator enters in the patient demographic data. The patient is just remaining comfortable in front of the instrument. The instrument module itself is already half full of fluid, ready for the disposable eye seal for each patient. Once the patient demographic data is entered, then we are ready to go. We save that, select the patient, and then move to the scan tab. At this point, the eye seal, sterile, is placed on the instrument. Again, we are at a half fluid level, so once this is placed on the instrument, then we will go ahead. Operator simply clicks the water fluid level button. We've clicked the white clamp shut, very important. Leave the blue clamp open. The white clamp is the drain. We don't want it to drain while it fills with saline. This is a reusable administration kit coming from the saline bag. Simple saline solution. The instrument itself is filled with distilled water, never touching the patient. Operator adjusts the level of the instrument. We want the patient to be fairly upright in their position, not tilting their head too far forward, in a very relaxed state. Chin rest is lowered. And then the right eye. The patient can see inside the instrument a very nice target. As you can see, the operator on the screen can see the patient's eye looking straight in. This is fluid filling the instrument. In just a moment, the eye will come back into clear view. If the eye seems to be a bit dark, the operator can change the camera setting to brighten that up. Taking a quick look to make sure that the patient is leaning in correctly against the instrument and that the eye seal is in contact all the way around. Prior to filling the eye seal with saline, the operator, once the instrument is full of distilled water, takes a few seconds. Once it's full, the operator is going to coach the patient through centering. We've selected an anterior segment scan. As you can see, the red line going through, it's a single bicanthal sweep of the probe. Nancy, if you would brighten the camera up, please. So here's the brightness. To bring that camera brightness up a little bit, now we can a lot easier see the patient's eye. We want to make sure that the iris is well centered in the diamond all the way around. Here the patient's lined up perfectly without any issue whatsoever. The instrument is full. Nancy's raising the chin rest just to where it supports the patient's head so that they can just relax. Meanwhile, the patient clearly is looking at the target, the fixation target in the center of the instrument. Double clicking on the monitor there, she was able to, just do a fine tune. The instrument itself will automatically center on the patient's iris, not on the pupil, on the iris. So the saline solution is coming in. It's a little bit cool for the patient. Oftentimes that eye does not want to blink. It's very happy in the saline solution, so we instruct the patients to hold their left eye, the non-operative eye, just hold that shut because it wants to dry out. So we're ready to initiate the scan. Everything looks good, well centered. A little bit of bubble. You can see a bubble on the right side. It's just attached to his lashes. Air and ultrasound really don't get along well. Ready to initiate the scan. Coaching the patient, keeping the eyes not blinking, keep looking at the target, looking straight ahead. You're doing great. Wonderful. The instrument is centering itself and getting ready to take the scan. So very quickly, there's the scan. That eye is done. Operator can go ahead and drain the eye seal of fluid. Just takes a couple of seconds. Patient blinks. The water is draining into the catch pouch. There's a tissue in the patient's hand already, and just a little bit of saline on the eye. Just wipe that off. We're getting ready to select the opposite eye. The instrument is fairly well aligned already. The patient's aligned. Sometimes we lower the chin rest depending upon the patient. Patient's already coached into what to look at. They're looking in. They see the fixation target. Nancy's adjusting again, closing the white clamp so that the fluid doesn't drain. Take a quick visual, make sure the patient's leaning up against the eye seal quite nicely. Doesn't have to lean in real hard, just good contact. Now Nancy can see again the eye is fairly well centered in the box, maybe a little bit off. Well, it's dry. If she wanted, she could have the patient reposition very quickly without worrying about any saline leaking. Coming back, have the patient lean back if you wish, readjust. And the patient comes right back at it and centered in there nicely. Slight adjustment on the chin rest, getting the patient comfortable. Again, the patient can see the target inside. They've gone through this already. Very quick scan, quick double click. Fill the eye seal with some fluid. Oftentimes have the patient close their eyes. It's a little cool coming in. Not too bad. Don't be in a rush. You can go ahead and have the patient keep their eye closed. The eye seal fluid will heat up quickly. Patients are comfortable. Again, the patient can reach in, open, or keep their opposite eye closed. We're ready to go ahead and initiate the scan, open wide. Very good. Initiate scan. It's going to do its automatic centering. Looking, patient still looking straight forward, trying not to blink. Eyes very comfortable at this point. Back and forth, instrument is centering, checking its distance off of the cornea at the same time. And then we take a quick scan and we're good to go. We can drain the instrument. At this point, we're done with this patient and we can go ahead and once the fluid has drained away a little bit, then patient can lean back. What we would suggest at this point is lower the fluid level to halfway on the instrument. For a patient workflow, this is a good move to do, and that way it's ready for the next patient. If the eye seal were removed from the instrument too soon, the distilled water could spill out. Again, it's just water, no big deal. And that is a quick scan of the image. Nancy is now just dragging both of those from the preliminary off to the final so that they are saved and ready to be viewed. We hope this was educational. Again, give us a call if you have any questions. We're here to help you. Thank you.